Hello and welcome. I am so excited to be talking to Loraine Ledon this afternoon. And today, Loraine is going to be sharing with us details of her presentation for the WAS 2021 Congress. Hi, Loraine. Please could you introduce yourself so that everybody watching can know exactly who you are?
Hi, Lisa. I would like to thank you for this special invitation to talk about the work we do. And we presented in the 25 Congress of WAS. My name is Loraine Ledon. I'm a researcher in the National Institute of Medical Science and Nutrition, Salvador, Zubirán, in Mexico City. Psychologist. I have a PhD in psychology, a master's degree in sexuality, gender, and sexual reproductive health. And I have a diploma in sexual health and sexological practice too. So my main work right now is researching with people with different chronic illnesses, especially endocrine and neuroendocrine illnesses, regarding its sexualities, its sexual and reproductive health.
Okay, thank you for sharing that with us. Wow, there's so many amazing things that you have been doing. So please could you let us know the title of your presentation?
Yeah, the title of my presentation was Sexual Function in Patients with Pituitary Adenomas, Integrating the Biopsychosocial.
Fantastic. Would you mind sharing a little bit about it and what we could expect to learn for anybody who watches your presentation?
Yeah. First, I'm going to talk to my work. I would like to share a bit about the history of this work. We began to research on this field 20 years ago. And we have found the support of different Latin American countries, such as Peru, Cuba, and Mexico. This specific work I have presented during the Congress was specifically with Mexican people, but we have worked for a few years through different populations. We began with qualitative methods, inquiring how people with different endocrine diseases lived their sexualities. And we found that it was a very important topic for them, even when we explore different investigations, it is really scarce the way it's being explored around the world. So in this moment, we are doing a mixed methods research aim to explore how this kind of populations live their sexuality from a biopsychosocial approach. So specifically, the work we presented during the Congress express the quantitative results of this wider investigation.
Right.
And the aim of this part of the work was to assess sexual function with in people with different pituitary adenomas, functional and non-functioning pituitary adenomas, and to explore the relationship of this result of the sexual function assessment with different biopsychosocial variables. This was the objective. I don't know if you want to that I continue to describing the results.
Absolutely, you're welcome to give us a little taster, a little teaser.
Okay, thank you, Lisa. So we assess the sexual function with the gold standard questionnaires for assessing sexual function. Those are the female sexual function index for women and the International Index of Erectile Function for men. Those are two different questionnaires for women and men. And besides that, we assessed their psychoaffective state through the Beck inventory, Beck depression inventory, and the Beck anxiety inventory. Besides that, we structure a semi-structured interview for collecting social demographic data, health data, and sexual and reproductive health data. With those information collected, we analyze descriptively and using different statistical methods. And what were the main results we achieved through this assessment? First of all, we found that the mean total score of both sexual indexes overcame the mean score for women and men. This was the first main results. Okay. Secondly, we found too that the mean score of each sexual domain overcame also the mean score, excepting for sexual desire, sexual domain for women, and erectile function for men. Okay. So the frequencies of impaired sexual function were around a third of the sample for women and men, but we found that half of them, more than half of women and the half of men, had impaired sexual domain, specifically in sexual desire in women and in erectile function in men. Okay. So when we made the associations, there were several variables who were associated with the score of sexual function, specifically the age in men, hypogonadism in women, and perception of sexual discomfort in women, and perception of fertility difficulties in men, while anxiety and depression in women. And for finishing, when we did the regression analysis, the only one variable who predicted a decreasing of a sexual function score in men was the age, and in women we found hypogonadism, the perception of sexual discomfort, and anxiety. So what did we conclude considering these results? First of all, it's important to consider the global results in terms of sexual function score, but it is very important to observe the details, specifically what is the performance of the different sexual domains. Secondly, it's important to consider, to take into consideration a gender approach to understand the differences between women and men. In this study, we compare according to three main dimensions: sexual, sex, age group, and the specific diagnosis, specifically functional or non-functional pituitary adenomas. Right. The only differences we found was regarding sex. And it's important because this topic is usually framed from a biomedical approach. Right. But it is very important to consider also the psychosocial variables.
Mm.
So this would be our main message. First of all, to value this field as a part of the integrated health of people living with different chronic illnesses, but specifically with neuroendocrine diseases.
Mm-hmm.
Secondly, the fact that they are living with a physical disease doesn't mean that another variables are not going to influence on the dynamic of their sexuality. And third, it's important to continue exploring and researching on this field, because it is very important for quality of life of these populations.
Wow, thank you so much for sharing that with us. And those findings are very interesting indeed. Who do you think would be who would this benefit most of all? Who do you encourage to go and watch the presentation?
Well, first of all, physicians who manage or who work with this population.
Mm-hmm.
Secondly, all health professionals who give health care to this population. And I also think that people living with any kind of chronic illnesses, but mainly people live with endocrine and neuroendocrine diseases. It is very important to enlighten this health problem and this population as a main target. And it was really inspiring for me, the slogan of the Congress, leaving no one behind. The fact that these kind of diseases maybe had or has a low incidence. Some of these diseases are considered rare diseases. For example, people with acromegaly or people with Cushing disease. It is very important to put them into the line of vision, because for them it is very important that they suffer a lot. And our experience as researchers and as healthcare providers with them is that they appreciate a lot to talk, to be inquire, to be that us are interested in their part of their life.
Absolutely, I couldn't agree more. That you're right, nobody left behind, and that includes people who, like you said, there may be a more rare condition, and it doesn't mean that their sexual health doesn't matter. So thank you for doing this incredible work and for sharing your presentation and for talking to me about it today. I'm looking forward to being in touch with you more. Thank you, Loraine.
Thank you very much.
Bye.